Another informative and educative edition of the program Broadway to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower you about health-related matters. Today is a Tuesday, April 21st, 2026, and driving you through this edition of the program are Angeline Noah and
Melvin Stewart.
So we also have Charles Ardeen and Josh here taking us live to the ministry's official Facebook page. So however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, make sure to like and share the live, inviting a friend to watch along with you. And to our dedicated radio listeners, it's always good to be here with you. Stick with us as we have another beautiful package for you this morning. We will take a moment to send special greetings to the Minister of Health, Dr. Louis Mpoto, her able deputies, assistant ministers, and all of the staff at the Ministry of Health. I'd like to say thanks in a special way for your continual commitment to shaping the health agenda of our country. This morning, we have invited in studio the expanded program on immunization of the Ministry of Health, represented here by two esteemed guests, Mr. Augustine Nure, Coordinator, Vaccine Safety Surveillance at the expanded program on immunization at the Ministry of Health. We also have Mr. Joseph Doe, Immunization Coordinator at the Ministry of Health also. So before we join our guests this morning, we will firstly join Melvin Stewart to bring us developments, updates, as we do here regularly on this program, bringing our radio listeners what's happening within the health sector, what is being done every other day. So we'll visit the Ministry's official Facebook page to bring development updates this morning. Good morning, Melvin.
Good morning, Angel, and also good morning to our listeners across the country and those of our online viewers from across the world. We'd like to say good morning and good afternoon just from wherever you are watching us. It's a pleasure. Yeah, I'm okay. I know you want to ask how did I spend my weekend. It was good how I spent the weekend in Cape Mount, where the President, His Excellency Joseph Walker, had gone to break grounds for a modern highway from the Simport Bridge all the way to the Bowater side. That would be a full lane way there for us as country and the people of Sierra Leone as well. The two presidents of both Sierra Leone and Liberia were in attendance. That was a very good occasion that I attended. And I enjoyed the cold fish there.
Okay.
So I visited that place and I enjoyed the pepper soup.
Okay.
Yeah.
So before we join our guests, as you already know, bring our people developments update from the ministry this morning.
Yes, like you say, it's a tradition on this program. We always highlight some of these things happening at the Ministry of Health. On the 20th, that was on yesterday, the Ministry of Health received a donation of intensive care units equipment from Project Q, and the donation includes 40 modern electronic ICU beds and mattresses intended to strengthen critical care services across the country. As part of the distribution, the John F. Kennedy Medical Care, that's the medical center, will receive 26 of those beds, while the remaining will be allocated to the counties to support healthcare delivery in undeserved areas. And new staff quarters dedicated at Picnices, that's in Picnices Clinic and County Drug Depot Commissions, as well. That is in Rivers. Is it Picnices? It's in Grand Cru, right?
Grand Cru.
Yes, Grand Cru. The Ministry of Health has dedicated a newly constructed staff quarters at the Picnices Clinic in Barclayville Health District, Grand Cru County. The facility is intended to provide safe and convenient accommodation for health workers, thereby ensuring their constant availability to and deliver essential healthcare services to the community. In a related development, the ministry also dedicated the Grand Cru County Drug Depot to strengthen the short storage and distribution of medical supplies across the county. The Drug Depot project was sponsored by the Global Fund with implementation from the Plan International. You see the photographs of these beautiful buildings here and it's a very good, it's a milestone development at the Ministry of Health. In continuation of our unannounced visits to health facilities across the country, Liberia's Minister of Health, Dr. Louis Maple Puto, engaged healthcare professionals at St. Timothy Government Hospital in Robertsport, Grant County. And during the visit, Dr. Puto expressed sincere appreciation to the health workers for their unwavering dedication to service delivery, acknowledging their critical role in sustaining the nation's healthcare system. She also emphasized the Ministry of Health's renewed commitment to strengthening healthcare services nationwide, highlighting ongoing efforts aimed at improving quality, accessibility, and efficiency across all levels of care. And finally, health workers in Bama get housing boost, right? And Bama, Bon County, that's Bapolo County, the healthcare workers housing units construction is nearing completion. That is in Bama Town, in Bapolo County, in the Bella Forest. And the project is being implemented by the Armed Forces of Liberia with funding support from the Ministry of Health through the government of Liberia's budgetary allotment. This forms part of ongoing efforts to strengthen the health sector by providing safe and adequate accommodation for frontline health professionals, particularly in hard-to-reach communities, thereby improving staff retention and service delivery. Yes, it's a motivational aspect of the work that the minister does at the Ministry of Health and all of our deputies and technicians. Because if you have an accommodation for your health workers, it gives them the hope, it gives them the courage, even if they are making little, but they have somewhere to lay their heads. That alone makes them to work overtime. So we say kudos to those responsible, Dr. Louis Puto, and all the people working in the health sector, the nurses, the caregivers, just whoever that works within the health sector. This is a milestone development from all of you, and I know collaborative efforts have been the way forward for most of these achievements in the sector. Yeah, India, so far so good.
Yeah, thank you very much, Melvin, for bringing our developments update this morning. So you can do yourself a favor for those of us who have access to smartphone by going on the ministry official Facebook page and that of the website. On every other day, development updates are being posted so that you will be informed about what's happening within the health sector. So with that said, April 25th to the 30th is scheduled as African Vaccination Week. Ahead of this African Vaccination Week, we have the immunization team here this morning to bring us awareness, telling us more about the importance, reminding us this morning about the importance of vaccines, the impacts, amongst others. So with that, we will join our guests this morning. They will tell us more about the global team and all that. I don't want to jump the gun. So let me begin with Mr. Do. Good morning.
Yes, good morning, good morning. Good morning to our radio listeners. My name is Joseph Do. I work for the Expanded Program Immunization, Ministry of Health. And let me say hats off to all of you and bring warm greetings from the Honorable Minister and the Expanded Program Immunization Program Manager, Dr. Adolphus T. Clark. Basically, we appreciate and then want to say thanks again for allowing us to use your platform to inform our people about vaccination service delivery, especially the African Vaccination Week that is aligned with the World Vaccination Week. Thank you.
Okay, so you are immunization coordinator. Just tell us a little about what you do in your role as immunization coordinator in summary.
Actually, immunization service delivery is being delivered everywhere across the country. And then I'm responsible to ensure that vaccination takes place effectively and efficiently, that our people get vaccinated against the vaccine-preventable diseases.
Okay. Mr. Nire, good morning.
Good morning, Haji. Good morning to those in Radio Lines. Just in line with what my colleague just mentioned, we are happy or feel privileged to be in studio again this morning among more than at least a dozen of colleagues. The program manager, Dr. Clark, graciously delegated to us to come and make this appearance this morning to discuss with our people across the 15 counties, which makes me to draw attention especially to our child survival focal points who are our immunization managers in the 15 counties, and the rest of the county health teams from Cape Mount to Cape Mount, from Vonjeman to Sestor, and the rest of the provincial cities of the country. We say we are grateful to be in studio again, and this is one forum when we come with feel relieved that we can discuss public health matter, especially talking about prevention. So thank you for having us on the show this morning.
Okay, you're welcome. Thanks for always honoring the invitation. So from the 24th to the 30th of April is often observed as African Vaccination Week. Ahead of this week, we are here to remind the general public about the importance of vaccination, amongst other things linked to vaccines. But before we dig deeper into our discussion around vaccines, I just want us to give a background of the African Vaccination Week, telling our listeners what prompted the decision to set this day aside. What are the issues it was set aside to address and all that? What is the African Vaccination Week?
All right, so thank you. First of all, African Vaccination Week is an annual public health event that takes place the last week in April across the African continent. And it aims to ensuring that our people are vaccinated. They are saved against vaccine-preventable diseases. This is being coordinated by the World Health Organization. And like I said initially, it is aligned with the World Vaccination Week as well. Thank you.
Mr. Nuri,
So in other words, it is not a fixed date. It's just a coincidence that for this year, the last week of April in 2026 coincide with 24 to the 30th. Next year, the date might shift slightly. So it is the last week of April each year. We do this annual undertaking that is followed by all member states of the African sub-region, of the African continent, and alongside the global community of the member states of the United Nations across the entire world.
You spoke of the alignment of the African Vaccination Week and along with the World Vaccination Week. If you may term it, what's the kind of cooperation like with the World Vaccination Week, because that is global. Now Africa is just on the continent. We are just talking about the continent. How do you work in line with the World Health Organization in terms of making this thing as a global one?
So in reality, looking at the coverages across the African countries, there were few countries that couldn't meet their desired coverage, and so African countries ministers got together sometime back 2010 in September to ensure that those that are lacking behind can be on path equitably to ensure that everyone gets the benefits. So in that case, the world at large, through WHO, decided to have the World Vaccination Week as well, seeing the significant, those strategies that were developed and put in place, ensuring that those who were at risk, getting the benefits in terms of being fully vaccinated against vaccine-preventable diseases. So the World Health Organization decided to agree with the African continents that was heard by the World Health Organization regional office to ensuring that this development or this strategy has been a very good strategy, and that's why it's been aligned. So in this case, there are more resources being mobilized and developed by the World Health Organization and other African unions to ensure that the both activity go along to have more resources available and to ensure that we reach everywhere across the last mile within the country.
What's the significance of this vaccination week in our setting as a country?
Let me just come in.
Yes, sir.
Then the chief coordinator of immunization can continue. First and foremost, WHO has subdivided the entire world into 6 basic operational regions. Region for Africa, region for Eastern Mediterranean, region for Western Pacific, for the Americas, for Europe, and Southeast Asia. So that makes up the global body for WHO. Then Africa, being called the African region for WHO, mobilized all the member states, like Mr. Doe just said, in 2010 to have this consolidated effort. So just to pick a single word, what we are doing along with the entire world, we call it synchronization. It's an activity that goes on across the entire world, all of the countries going together, and it brings about one word we call solidarity. It means we are holding together. That is why sometimes we will follow the football game, we make fun or we try to follow a particular team called the Liverpool. We are not alone. We are part of the whole. So Liberia is joining the West African sub-region of West Africa join the rest of the African regional or setting, and then Africa joins the rest of the 5 regions of the WHO, so that we go together in a form of sweeping that will leave no one behind, especially with awareness on issues that as we go along this interview, we will bring to light.
Mr. Do you want to come in?
Yes, so actually the strategies is basically to increase vaccination awareness and vaccines uptake everywhere. So in this case, there are a lot of strategies that are being put in place, because during African Vaccination Week, we use all of the different vaccines to carry out this exercise. So this is an exercise that actually do a long list of where we have our people who were lagging behind or who yet to get vaccinated. And so in this case, there are a lot of goals put in place. Like the first one, you need to reach and extend to the unvaccinated, and then you need to reach those ones that were partially vaccinated as well and needed to get vaccinated. So in that case, we need to showcase of vaccines benefit as well. So when the community is fully vaccinated, meaning the community dwellers, all our population is fully vaccinated, then of course we're going to reduce outbreaks and increase the vaccination coverage. Now, if that is done, that will also give room to having more resources from our donors and partners as well to help the country in portraying the efforts of the country to ensure that vaccination, is at the high peak and there is no outbreak coming up as usual. Thank you.
Why is it important to have vaccination week almost every time when you are administering vaccines almost every day in the lives of citizens?
I think I can take that one. For me, I like when I discuss in these kind of settings to give examples or to do some imagery. I liken this to people who follow Christendom. Every Sunday or whatever day your own denomination chooses, you go in your congregation. But they have set aside times, what they call revival. This is what we are doing in the immunization sector. We are vaccinating daily, yes. We are vaccinating every week, yes, every month, every year. But this is a week set aside because along the days we vaccinate, there are programmatic issues. There are drawbacks for which we are not seeing all the number of children, women that we should vaccinate, those young girls we should vaccinate at a specific time interval. So this time of the African Vaccination Week is set aside as a reawakening, making a call to our policymaker, making a call to our community dwellers, making a call to our parents to bring the children, making a call to even our service provider to take on their time to conduct those outreach sessions they plan so that they reach to those who are within long kilometers away from health facilities. So this is a time of reawakening that will bring out the spirit of immunization alive.
Mr. Doe?
Thank you, Gus. So actually it is to save life. That's the first thing, and the next thing is to strengthen the health system as well, and then create more awareness to ensure that our people get their full benefit in terms of vaccine codes. Thank you.
So let's talk about the impact of this week. Since you started this regular awareness every year within this particular period, what impact has it made so far?
So for the African Vaccination Week, or the World Vaccination Week, as we may term it, there are a lot of impacts that it made in terms of vaccination service delivery. So the first thing is it's going to help us in the situations that all of those who were lacking behind, again, as we said earlier, those people will get the benefit, they'll get vaccinated. And then most beside, you will notice that at some point in time, our vaccinators won't be able to reach at certain point or at certain areas that we may term as hard to reach areas. So during the 7 days intensive vaccination exercise, we ensure that all of our service providers or healthcare service provider vaccinators move over to those places because, like I said initially, there will be a long list of areas where we have a lot of people lacking behind. So one of the great impact it made is to vaccinate those people that are lacking behind. It makes more effort of, providing more resources for us to be able to, achieve the programmed goals as well, that is aligned with the global strategy.
It might be just waiting a little. I will support my colleague further, by making a 3-point count in terms of impact of this week. First and foremost, he just mentioned we go out to areas that are not being covered with vaccination services in a term that we call outreach services. And that brings us to a point, count one. In this week, lives are saved through potent or life-saving vaccines. The second count I will bring is about regional solidarity. Today, or this week, Sierra Leone knows that Liberia has an immunization program, same between Ghana and Nigeria, Cote d'Ivoire and Benin, and down to the south, going to the island of Madagascar. We are all going together. It means we are holding together to make immunization services thrive across the continent. The last one that I want to mention is what I call expanded scope. It means we are going beyond vaccination and even integrating. That means bringing other services for childhood service, other life-saving services for child health, such as like deworming of children. We have the program. We work with our nutritional colleague from the other part of the ministry. We also do vitamin A supplementation to prevent blindness. So you see, we save life, we hold together as a region. At the same time, we expand our scope of work beyond immunization.
Yeah, so we are talking about vaccines, especially linked to the vaccination week. I want us to give our listeners an idea of what this vaccine is and its importance, so that, when you go out there in the field and you are talking to them, they will understand the importance.
Yeah, so actually there are some preventable diseases. Like the most common one that I think most of the population know is like the polio, because every time they have polio vaccination campaign, just for example, measles as well. So once the child has taken the vaccines fully in regards to the number of doses schedule.
So I'm saying, let's tell our listener what vaccines are and the importance of
Exactly, that's what I'm
vaccine.
driving to.
Okay.
So once the child has taken the full doses in schedule, it means that that child body will be strong enough to fight against that particular disease for which the child has taken the vaccines. For example, in the case of the adults, the female, so a pregnant woman needs to take vaccines 5 different times in her life. All right, so when she takes the vaccine for the first 2 times under her pregnancy, it means that the child that she's bearing has had some form of protection against neonatal tetanus. Once the woman gives birth to a child, and that child has been born, and unfortunately, the child has gotten in contact with any of the bacteria that may cause the neonatal tetanus to that child, it means that that child has been fully protected, and that child will not come down with neonatal tetanus or pass off. So once you take vaccine, it means that you are safe from what? Vaccine preventable diseases. But mind you, you have to take it in regards to the number of doses per each of the vaccines to be fully vaccinated. Yeah.
So we have series of vaccines on schedule in Liberia. But for the understanding of the community, we are struggling here not to bring issue about the chemistry around vaccine or immunology or vaccinology, but just to put it square. A child that is born today For up to 23 months of age, we expect the caretaker or the parent to continue making contact with health facility where services are available for vaccination until the child reaches a point that we call graduation. And at the vaccination table in each clinic or hospital that delivers services for immunization, they will tell you line upon line when you should make this visit, when the subsequent visit, and when the other visits are. We have several vaccinations scheduled beginning with the birth that we call the BCG, which prevents like tuberculosis. And down the line, we conclude with the newest on the schedule that we call a malaria vaccine.
Okay.
All right, and so and to add continuance to what he just said, actually, vaccination is safe and free. There is no cost attached. That when the mother carries her child to the health center or the outreach site, they are not going to pay a dime to receive vaccines. That's why even in the facility, you are not going to pay for vaccines because this is one of the public health strategies that has been used to prevent our population. Thank you.
Now, anybody can answer this, or if the two of you can make contributions. But let's, because it's African Vaccination Week, from my own little research, it was endorsed in 2010. And last year, the theme for this African Vaccination Week was immunization for all, humanly possible.
Quite correct.
What is the theme for this year as we kick off the process?
So the theme for this year is, for every generation, vaccines works. So that's the theme for this. It means that even at the time we're not even born, our forefathers or parents that took vaccines, the same immunity it provides nowadays is also provided that same immunity during their days. So moving forward, even when we pass, the next generation, it will be the same thing. Vaccine will still, work and prevent in regards to the bacteria or virus that is being prevented against.
And with that team,
yes,
then it brings us to some little level of history around vaccine globally and even locally in Liberia. Down the line, from the eradication of smallpox, that is the wiping out away of smallpox from the globe in 1978, around the 1980, Liberia joined the Federal countries to introduce the immunization program. And on from the polio vaccine, the rest of the vaccine, we kept adding until the latest we did was the introduction of the malaria vaccine in 2024 with the scale up to the entire country last year to make sure that in addition to other preventive measures for prevention of malaria, vaccine is part of the package. And with the generational team, tomorrow other vaccine might come. Currently, we are vaccinating and fighting the mpox outbreak in the country using a potent vaccine that is approved. We just put down a couple of years ago the pandemic on COVID-19 using the COVID vaccine. So vaccine will come as science continue to thrive. So using the science around vaccine, we say generation to generation, vaccine will continue to save lives.
Do we have surplus of vaccines in country?
I would say yes, but the word surplus, I want to go away from that because the immunization is one effective public health intervention across the globe, with Liberia being a part, that will do what we call forecast. We determine the need of the country for a whole year or for a particular
because you don't
period.
want to keep,
so we do it in line with the population,
right,
or in line with the coverage, that is the number of persons we are vaccinating. If we stick to population, for instance, areas along the borders, our neighbors do not have health facility close, so they are not part of our public, but they take services. So based on numbers that we collect from previous time to the current time, we do the need forecast to know what quantity of vaccine we need, and we make sure that supply chain is maintained with the devices that will keep the vaccine under the required temperature before delivered to the clients.
In terms of the administering of these vaccines, sir, I take into consideration hard-to-reach areas in African region. how do you tackle some of those areas that you sometimes find difficult to reach because the people who might not have the time to come to hospital or to come to the nearby health center for this vaccine?
I have my service delivery coordinator. Maybe I would just kick the ball rolling for him, and then he would take the rest of the time.
Yeah, you can go ahead.
I just want for us to understand the terminology first, hard to reach. Most time people think about only geographic access. Like you think about the area of Nifu in Grand Cru, where you got to trek across barrier of rivers, or you think about the Plo Bowl region of Grand Jide that you have to walk for almost half a day before you reach the first village. And on, Yanni in River says, you talk about the area beyond the Ziliba River, or what we call the Zola main area there in Lofa, and the terrains are difficult. So we define how to reach with geographic barrier, and even in urban area, the hostel buildings, our vaccinators struggle to get there. The security risk community, some areas of Monrovia alone, they are even hard to reach. Vaccinators just don't venture there. You have to create special rapport before you go to those places. Indeed, we have strategies to reach in those kind of places where we have population setting. Jido.
Yeah, so thank you, God. So actually, in the immunization service delivery, we have two major strategies. One is the supplemental immunization activity, and one is the routine immunization. The next one is the routine immunization activity. So the routine immunization activities has to do with a fixed strategy where it's to be done at the health facility, and then the outreach that Mr. Nire just spoke of is where you determine what are those areas that are very difficult to get to, that our people are there cannot get the benefits in terms of vaccination service delivery. So in that case, the facility at the county level, they go ahead and do their own land lays and plan the strategies to see what are those communities that are very hard to reach and what the best means of us getting over to the facilities. So when they do that, if it requires any support from us at the national level, then we also intend to do so. And then we help them as well to go along. So normally we support them on the monthly basis to go to do how to reach areas that will be able to facilitate their movement, be able to find means that will get over to whosoever is the head of the community, and then engage the community, and the community themselves give their own schedule and say, look, this time will be very feasible for you to come over to us and to provide a service because our people are unable to go to where the facility is due to maybe, like he said, mountains, it could be valley, it could be rivers, broken bridges, no way to get across easily. In that case, the vaccination team prepare their own plan and get set because, like he said, vaccination, determining the doses of the different vaccines has to do with forecasting. So when they know exactly what are the number of persons in those areas, because you wouldn't want to go there and leave some people out. So you have to forecast and know how many persons there that need the service. What are the different vaccines that you think they also need? So you make sure you have everything in one package that we refer to as the bundle vaccines before the team can move over to those places and provide a service to them. But actually, it is difficult in the absence of support. And so that's why we've been trying our weak ways at the Ministry of Health, supporting them on a monthly basis to ensure that the guys move over to our people. Well, how be it, they had so many other areas like mining areas and other places. Every time you see the guys are reshifting whatsoever they have.
Find the mineral there where they go.
Yeah, that's it. So in that case, it has been giving our vaccinators a little bit tough time. So what we did was we developed another strategy that we refer to as the special vaccination strategy, where we have certain vaccinators that were trained, prepared, and go and just move over, tracing the guys whatsoever they go to provide the services to our people. So that's the way we move out to them in places of hard to reach and difficult to reach areas.
Let me quickly just piggyback on the last statement you mentioned about support. And this is one area that the African Vaccination Week seeks to address, the issue of advocacy for budgetary allocation or increment for immunization service delivery. Currently, Liberia is among cluster of countries that are supported by the Global Alliance for Vaccine and Immunization, Gavi for short. It's not a Gavi who plays for Barcelona, but it's our Alliance for Vaccine.
Okay.
GAVR.
GAVR.
Exactly.
Before the Barcelona fans start jumping around, like Gavi is supporting Liberia. Let me make it clear. So with that support we are getting, this is how the immunization program is sustained. But again, with the global meltdown of financial crisis everywhere, that is not sustainable. Before, years back, we were doing this Gavi support. They were giving us 80% of our immunization support with vaccine procurement, coaching, equipment, and the rest of the service delivery and the setup. And government of Liberia provides the remaining 20%. So, take for instance, if the budget for immunization in Liberia this year was to be $1 million, Gavi was providing $800,000, and Liberian government gives only $200,000. But that benchmark has reduced. Gavi, with the funding drought, is now requiring countries in the co-financing scheme. I mean, you put your money in, I put my money in there. They are now requiring us of giving 30% co-financed, and they dropped to 70. So that 30% with the current budget we are having, that's why we are here. People who are responsible, the policymaker, the legislator, as they debate the next budget, immunization, we say, is a piece of the pie. And like we say in all of our setting, prevention is better than cure. The budgetary allocation will protect the Liberian child, will make them strong to go to school, will give them the strength to go to school, and they become medical doctors, they become teachers, and you name the rest of the profession. So immunization in Liberia, we think, is a destination for increased budgetary allocation in Liberia.
And we hope to get there someday. We certainly will. So, Mr. Nure, you mentioned that sometimes when you go in various communities, not only they are hard to reach as in crossing river, but sometimes you go in various communities, sometimes you have to build extra rapport to have the community dwellers welcoming the effort of vaccinating citizens. So let's talk about the role community leaders or religious leaders play in supporting this effort.
Thank you. I think that is a very good and key question to this discussion. All of the service delivery we mentioned since minutes ago, we entered here and started voicing on this airwave. Everything that is done in the immunization program, the finale, that is the end, everything takes place in the community. So the community is our key partner and ally. Without the community, immunization program does not exist. And so that is why each time when we take this kind of discussion, we make some clarion calls, we make clear calls to the different segment of communities. In the community, we have our religious leaders, we have our community leaders, we have the traditional leaders, we have different array of leadership. Those are the structure we go through. Let me just take it from the Leeward counties. And we have a very strong and good connect between health facility and the community through a program we call Community Health Assistance Program. They are the one that even helping us to go after children that should be vaccinated that are not returning, so that we get them back into the program to make sure they complete their schedule. So the community will rely on you to pass the message on, because sometimes we have misinformation from some community around immunization. But if our community leaders will get a message, our pastors will get a message, our imams will get a message, and the rest of the leaders will get a message, the teachers will get a message, they will pass on to the student during their PTA meetings, the messages will be shared. So the community is our key partner.
And just to add to Mr. Nere, that's where community ownership comes about. So once the community health assistance he talks about, continue to engage the community and letting them know the importance of vaccination, of course, they will take ownership and then be willing to support the health facility in terms of mobilizing their people to come over to take the vaccines. Because you won't have the vaccines there, and those who are supposed to benefit are, keeping away or sharing away from the vaccination of service delivered. And at another side, you see that people start coming down with vaccine preventable diseases and things like that, so which wouldn't be good for us. So the CHEs are always engaged to also engage the communities to ensure that the community take ownership of vaccination.
Okay, we also open the phone lines, but before we do that, Mr. Nure, you also talk about baby mothers taking their babies to the nearby health facility to get the babies vaccinated? You mentioned is it BCG or something?
Just one.
Yeah, just one of the many vaccines
yes.
they need to carry the children for.
Yeah.
But in a case, because people have this habit, sometimes they go the first dose, they don't want to go back. So in a case where maybe a schedule is given to a baby mother and she misses that schedule, what needs to be done?
This is one of the key things the program from the ministry EPI has undertaken over the year. That those who started the program and out of a sudden they fall off, we call them defaulter. And tracking them is one key thing that we are doing currently. We have a system to go and first know who is not coming back or who has completed. So I mentioned a few minutes ago the community health assistance programs. Mm-hmm. Within each of our health facilities, especially in the rural part, we have the clinic set up headed by the officer in charge, and one of the key professional staff that work there, we call them the community health services supervisor. They are the ones supervising the guys at the community who call the CHAs, the community health assistant. So if a facility A, for instance, or let me just use a live facility, if you went to Bunandi, the CHS is there. She or he is coordinating with the vaccinator in our facility, in our clinic. At the end of the month, children that are expected to come and they didn't come, the vaccinator passes the list onto the CHSS. The CHSS, knowing the location of the different CHAs, will now dispatch those names, say, hey, there's a baby so, there's a baby so, there's a baby so that should have been brought back this time. And the CHH will do the referral. Now, this program describing is not yet to perfection, but it's working actively to help us to track. More so, where CHHs are not available, we use a recording system we call a reminder card that will have a box. When we vaccinate you this month, you're supposed to come back next month. We drop your information in the box.
Oh, okay.
And then wait, when you do not return in that month, we just take your detail, telephone number, and make a call, especially for urban areas. But I think my immunization coordinator, who is a service delivery chief, can expound on that more.
Yeah, I think, Gus, you have said it, and that's the strategy that is in place. So it is important and very key that our people who may not want to go back, maybe due to ignorance or something else, or due to financial strength, that they are unable. So in that case, we have the strategies that Mr. Nere just listed are put in place to ensure that our people get vaccinated. So one of the other ways around it is our community leaders, either the chief or somebody else who is more influential in the community. That person's at time when we are having some other vaccination activities like the polio vaccination campaign, they are brought on board as well, to participate so that they can understand that vaccination is real, it saves lives, it's free, and then moving forward for the routine aspect that we are discussing right now, they will be able to, encourage the people to move over to the facility to take the vaccine. Or when the vaccinator move into the community to provide the service with all of the different vaccines, it means that they will encourage the people as well to take the vaccine. Thank you.
Okay, so let's have the phone lines open now so that our listeners can participate. So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We're in talks this morning with our health experts from the Ministry of Health, specifically the expanded program on immunization. We are talking the importance of vaccines this morning. So to be a part of this discussion, you can call us on 0775 677 376. 0775 677 376, 0880 514 096, 0880 514 096 are the numbers to call us this morning and be a part of the discussion. If you're a baby mother, you're a baby daddy, you are out there and you want clarity on anything about vaccine, you can call us this morning. Let's take our first caller.
Hello.
Good morning.
Good morning.
Your name and where do you join us from? Please walk away from your monitor.
Okay.
Walk away from your radio, please.
Yes, Mr. Fanny. He passed away from Uruchua.
Let's hear you, Mr. Vanny.
I want to find out is a book. When I was listening to on the vaccine issue. Thank you very much for bringing it all for at least the coverage question, please.
Go
I want
ahead.
to know the fasting that we are talking about. In case if somebody can't talk or sickness, like sickness, like infection or other diseases in the body, living body, up to 10-15 years before the vaccine can the vaccine cure a particular sickness from your body after taking it? Number one question. Two, I want to know this particular vaccine from 1 day old baby up to the time, the year that the vaccine will cover. How many sickness actually the vaccine can cure from the living body to be something that it will not come back to you again? That these are the two questions that I want to know from the explanation.
Okay, thank you very much.
All right.
07756773760 08805140960 08805140960 07756777376 are the numbers to call and be a part of this discussion. While we wait for more calls, Mr. Nuri, you can just respond to the first caller concern.
Precisely, I can. Thank you, Mr. Passawe. I hope I got your name well. You are concerned about infection or diseases that somebody may have had over time or currently. Which vaccine or whether vaccine can cure them? If I got you right, the answer here is that is why you are clearly hearing us. Vaccination is not a treatment. It's not for cure, but it's for prevention. We are telling you do this so that when a sickness comes, it will not have a hold of your body. You're only building protection. You're building fence around your house so that rogues will not just enter otherwise. So it's for prevention.
Okay, let's take this person. Good morning.
Good morning.
Please walk away from your radio.
Okay, let me put it off. Please. Yeah.
Okay.
Hello?
Yes, go ahead. Your name and where do you call us from?
This is James Nawa calling from Rawaswi Unification Town.
Okay.
Can you hear me?
Yeah, go ahead.
Yeah, even though I have a suggestion or recommendation, I know people when they hear it will be feeling different way. In Liberia, our country is very small. To prevent all these things where there is area that are difficult to reach, like in a rural area, places like Grand Gile, Nimba, all the way in the bushes. Actually, we need something, a helicopter, that will uplift the vaccine to go there. That will be so easy because you wouldn't want distance to uplift you in a helicopter. Everyone gets money. We can purchase one helicopter to do this work. A healthy population is a better country. Mm-hmm. So I think this is my recommendation.
Okay, thank you very much.
Yeah.
08805140960 07756777376 07756777376 08805140960. Mr. Nuri again.
So we return to Mr. Passawe.
Yeah, Mr.
So your first question, Mr. Doe will take the second one.
Okay.
That talks about how many sicknesses do vaccine cure from the body. He will take that. So once you are sick with the disease or the sickness, the next thing you need to do now is to go to the health facility. It can be clinic, hospital, or health center for treatment. You pass the vaccination age for that particular condition. Thank you. Mr. Doe.
Mr. Doe.
Yeah, so in terms of the diseases, like Mr. Nere said, like you build your house and then you don't want somebody to, go into your house easily and then, either take off some things but through means of burglary or something else. You build a fence, right? So that people can intrude easily. So it's the same with the vaccines. So you take the vaccine when you are well to prevent the body, to make the body stronger, that when the sickness come on you, it won't be able to knock you down. Okay. So those diseases that we talk about, one of them is the tuberculosis that we give vaccines so that the children body can be more stronger. They can come down with tuberculosis, which we refer to as TB. In common word, we call it the big cough sickness. Then the next one is the cripple sickness, the one that can cripple the children, that we refer to as the polio, make their foot weak or their arm weak and then able to walk straight. And at the United States, they remain like that for lifetime. So we also give vaccines for that to prevent them as well. Then there are other diseases that have to do with difficult in breathing, coughing, sneezing, wheezing, that sometimes causes the child to pass off immediately while wheezing or coughing. The child just faint, and then now they say the child died. We got vaccines for that as well to prevent the children from those diseases. Then the next one we have is the one that has to do with the yellow fever sickness, the one what the people can call yellow journal. So we have vaccines for that as well to prevent our children. And then the most one where everywhere they say, oh, measles is everywhere, killing our children, measles catching our children. We have vaccines for that also. So once the children take the vaccines with all of the required doses, it means that their body will be strong against those diseases. And then we also have the human papilloma virus. In common word, we call it cervical cancer, but that is basically for female. So the vaccines we get, we have it for our children, 9 years to 14 years, girls are the ones that actually will give the vaccine so to prevent them before they come down with that cancer sickness. So the next vaccine we have is the one that prevents the child, the unborn child, from having tetanus. When the mother is under pregnancy, it's preferable that she take at least 2 doses before she give birth to the child. It prevents the child from coming down with tetanus. We also have vaccines that prevent COVID-19 that we all know of. We have vaccines for that. When you take the COVID vaccine, you will not come down with the COVID vaccines to pass off like that. And we also have, like Mr. Nero was saying, the mpox that is now, we're trying to combat. Mpox is a disease that can catch anybody and bring all kind of bomb right over your body that even when you see the person, it becomes so difficult that you don't want to even associate with the person. So we have vaccines for that as well. So all of the different diseases that we just talked about, we have vaccines for them. But we are not saying that when the disease catch the person, then they need to take the vaccine and the vaccine will cure them. No. So we need to take the vaccine as we are well already in our bodies. Then when the sickness comes on board, it will not knock us down to cause death or harm us anyhow. Thank you.
Melvin?
And then lastly, the guy, there's a caller who says something about helicopter. I remembered years back, immediately after the war, we were airlifted to places, difficult places where we thought there was no road. You can't get across the rivers, you can't get across the mountains. We did that in the past, but at that time, it's like the country was in an emergency stage. After the war, immediately, that's when we have that opportunity. But I think that's a very good thing. But, it's very cost-intensive. So, but however, we take that into consideration. Maybe my brother Gus want to speak to that, but we take that into consideration. But it's just very cost-intensive, and which we need to recommend further as well. Thank you.
I think that James from UTC, Unification Town.
Yeah.
Your dream is good for the program. In fact, as we sit here, you go to countries like Rwanda. Rwanda is using drone to deliver drug supply to the rural parts of the country. And other countries have other means of shuttling supply in a space of time that is convenient for the system to thrive. So for now, like what you describe, our own is not helicopter, but we have a system where even there is no equipment to keep the vaccine, we put in cool bags, we put it to a place, our citizens come, and our vaccinators are there to vaccinate.
Yeah, we don't have time now, so we just go across and get the party comments from our guest. Yes, we begin with you, Mr. Du.
All right, so thank you for allowing us to use the platform, and we want to say to our listening audience, vaccine is free, vaccine is safe, and let us take ownership of vaccination to ensure that all of us get prevented against vaccine-preventable diseases. So the vaccines is everywhere. When they come to your door, please ensure if they are in your community, please ensure you turn out to get benefited. If they are at the health facility, also you need to go there along. But what is key is if you have taken vaccine before, The vaccination card is very important. Please keep it and take it along everywhere you go. Because the vaccines is into doses, so they will know exactly what are the services that you actually need, what are those ones you have taken before, and what are the ones you need to continue with. Thank you.
Yes, sir.
So, the week 24 to 30 April 2026 is the African Vaccination Week. All countries on the continent of Africa are intensifying their routine immunization services by going out to the communities, whereas the health facility fixed sites are still working. Liberia has sought to postpone her own field activity due to some program congestion. There are a lot of activities. So come May, we will come back to you, and they have our voices. Every community will cover. The next thing we want to leave with you, just like in the days of old, one scientist wanted to move the entire earth with a simple machine, but he didn't have a place to stand. But he didn't believe in God. He believed only in nature. He said, give me a place to stand, and I shall move the entire globe. What we are asking as a program, immunization, we need budgetary allocation will reach every last mile. Our children will be protected. Thank you.
Thank you.
Okay, thank you very much. Many thanks to our guests. Vaccines are free and safe, and you can find vaccines everywhere, nearby health facilities. Make use of the opportunity to get yourself and that of your children protected against preventable conditions. With that, this is how I would like to leave you on today's edition of the program Roadway to Health. Many thanks to our guests again, that Mr. Nira and Mr. Doe, for sharing such valuable insights. We have been your host, Angelina and
Melvin Stewart.
And George and Charles Adin have been here taking us live. Until next Tuesday, have a good day.